Hi, Dr. Larson with Euphoria Health. I wanted to take a little bit of time to explain the Swiss cheese model for respiratory defense. And in this situation, I'm mainly going to talk about flu, although you could talk about coronavirus or common colds as well. So the 30,000 foot view of this model is if you kind of view this red line as a vector and its ability to get all the way through all of these rows of Swiss cheese to get to the human over here. That kind of represents all of these barriers that we might implement for that to happen. And in total, when you combine all of these measures, you can reduce the likelihood of getting sick. And so I'm going to start over here with vaccines for the flu. These are traditionally about 40 to 60% effective each year. And that's from keeping you from getting sick in the first place. Even if it doesn't keep you from getting sick, it can reduce the severity of your illness. And so that's kind of the first piece of Swiss cheese I would implement. Then over to physical distancing. And so the further that you can be away from people, the less likely that any respiratory particles that would include viruses are going to get to you. So the further you can distance yourself from others, even while communicating with them, the better. Beyond that, we have ventilation. So we're talking about things like either try to be outside if you can be, or if not, and if you're inside, if you can open windows and increase ventilation within the room that you're in, what you'll see is that airflow is going to move viral particles away from you and help reduce your risk of catching those viruses. Beyond that, masks. So masks, what we're trying to do is use materials that it's harder for the viral particles to move through and kind of dampen the ability of the viral particles to move around when someone else is talking, coughing, laughing, singing. And so what I would suggest is if you're not using a surgical mask or an N95, basically hold your mask up to the light. And the more light that you can see coming through that mask, the less effective it's going to be. So try to use a mask that's going to reduce the amount of light that comes through it. And that's representative of how many viral particles might get through. As far as hand hygiene, soap and water is going to be best. It's going to be better than alcohol containing solutions. And when you're washing your hands with soap and water, you want to be able to sing the happy birthday song twice. And that's about the amount of time that you're going to need for this to be effective. If you feel like you may be coming down with something, certainly talk with your doctor and ask them if testing is appropriate. And then quarantine is really effective way to keep from passing this along. And so as Americans, we always kind of want to go back to work and do our part. But in these situations, really, it's worthwhile for you to kind of just quarantine at home alone. And in doing so, you're going to reduce the likelihood that you're passing this along to others. If you guys have any questions about any of these or want me to go into more detail about any of these slices of cheese, let me know. Thanks.